Knowledge and Prevention of Sexually Transmitted Diseases in Today's Youth by Marlon Andrews. In slide 3, we'll be actually giving you the definition of STD and what it is. Slides 4 through 6, it's going to be more so general information about sexually transmitted diseases. Slides 7 through 11, I'll give you the common sexually transmitted disease and also the signs and symptoms of each one. Slide 12, prevention techniques and strategies. Slide 13, research on Mississippi teen STD rate. Slide 14, that'll be my reference page. What are sexually transmitted diseases? Sexually transmitted diseases are infectious diseases transmitted through sexual contact. Use with male and female partners may face increased chances for contracting STDs. About 9.5 million adolescents and young adults are diagnosed with sexually transmitted diseases each year. An estimated 4 in 10 sexually active adolescent females between ages 14 and 19 actually have an STD. The rates of youth that have had sex before age 13 are higher in urban areas. By 10th grade, 44% of teens nationwide report having had sex. In 2008, males accounted for an estimated 71% of all HIV diagnoses among adolescents ages 13 to 19. That's a very high rate. STDs do not discriminate. It doesn't matter if you're gay or straight, if you're married or single. Anybody can get an STD. Although condoms are highly effective for reducing transmission of STDs, it is not a guaranteed method, which means that you can still wear a condom, but it does not guarantee that you will not contract an STD. STDs are not always obvious and can be asymptomatic, which means that you could have an STD and the symptoms not show up for a period of time. For chlamydia, it could take up to 3 weeks for it to actually show up after you've been exposed. If diagnosed with the STD, you want to make sure you get treated. This way you won't, if you were to have sexual intercourse with somebody else, you wouldn't give that STD back to the person that actually had it the first time. Some common types of STDs. The most common in females is trichomonas. Then actually you have another common one, chlamydia, gonorrhea, and also HIV is becoming more common in today's society. Chlamydia is a bacteria infection of the genital tract. It may be difficult to detect because there are usually no signs at the early stage. Symptoms usually occur 1 to 3 weeks after the person has been exposed. The symptoms could include painful urination, low abdominal pain, vaginal discharge, pain during intercourse, and testicular pain in guys. Gonorrhea. It's also a bacteria infection of the genital tract. Symptoms usually appear within 2 to 10 days after exposure, so it happens a little bit quicker than chlamydia. Symptoms, it could be thick, cloudy, or bloody discharge from the penis or the vagina, pain or burning sensation when urinating, abnormal menstrual bleeding, painful or swollen testicles, painful bowel movements, and itching. Trichomonas, common sexually transmitted infection caused by microscopic one-cell parasite called Trichomonas vaginalis. Usually infects the urinary tract in men, but often it causes no symptoms, which means that most times in men, they won't even know they actually have trichomonas, also known as trick for short. It typically infects the vagina in women. Symptoms could include vaginal discharge, vaginal odor, vaginal itching or irritation inside the penis, pain during intercourse, and painful urination. HIV. HIV is an infection of the human immunodeficiency virus. HIV interferes with the body's ability to effectively fight viruses, bacteria, and fungi that actually cause diseases, which means that the body, it actually can't defend itself like it would if the disease or the virus wasn't present. It can lead to AIDS, which is a chronic, life-threatening disease. It's actually the end stage of the actual HIV virus. Symptoms include fever, headache, sore throat, swollen glands, rash, fatigue, weight loss, cough, shortness of breath, night sweats, chronic diarrhea, unusual infection that they wouldn't usually have, shaking, and even chills. This just actually depends on which state of the actual virus or AIDS that you're in. Prevention strategies. First of all, practicing abstinence is the best prevention. If you're not doing anything, then you can't put yourself at risk for anything. Also, choosing low-risk partners. Partners that hadn't been sexually active with more than one person or with a minimum amount of people, you're going to be less at risk to actually catch it because they hadn't been exposed. But that doesn't mean much, just depending on who the person is. Because that one person could have been slept with somebody who actually has a virus and that could transmit it to you. That takes me to discussing the partner's sexual history. You always want to know what the person is doing, you know, who they've been with, if they've been exposed to anything, if they've ever had a disease. That just lets you know what you're getting yourself into before you do it. Using condoms consistently. Always make sure you protect yourself. Condoms, they don't, like we discussed earlier, they don't actually eliminate the chance of you getting it, but it does lessen the risk. So just because you wear a condom don't mean you can't get an STD, but it does protect you and it makes your risk less. Not having multiple partners. If you have to have sex, make sure you have a partner and you stick with the partner. Don't be jumping from partner to partner because then you're putting yourself at a high risk. Teenagers in Mississippi account for 40% of STD cases in the state. Which means that that's almost half of all the STD cases in the state. There have been an increased number of teens in Mississippi reporting to be sexually active at a younger age, which is one of the primary reasons the nationwide study showed the increase in the adolescent STDs. Out of all the cities in Mississippi, Jackson is has the highest incident of the cases of STDs in the state.